I can't tell you how many websites I've seen that said, we're transforming healthcare. We're revolutionizing the way that healthcare is done. No, you're not. No, you're not. And the fact that you're claiming that tells me that you don't understand who your audience is, because your audience is not all of healthcare. They don't want you to transform all of healthcare. They have a unique, acute problem that you can solve. So address that.
Doug, thank you for hopping on today's podcast. I know both you and I, we work with a bunch of different health tech companies, and we're in this sort of similar community, and excited to speak to you today and spotlight the work you guys are doing at HealthTech Content. To get us started here, can you tell us a little bit about yourself and like how you found your product market fit with your company, and like some of the first few like health tech client wins you had? Let's start there.
Yeah, man. Thanks so much for having me. I appreciate it. It's gonna be fun. It's been a bit of a journey with HealthTech Content. I sort of stumbled into this whole world, as I say, in my previous life as a professional country music songwriter, and did that for a long time. And as I was transitioning out, wanted to not be on the road all the time and do all that. I happened to fall in with a medical device company, and I had no marketing experience. I don't know what they saw in me, but they saw something and they took a chance and set me up to help support a product that wasn't performing quite as well as they'd hoped. Essentially, what I was doing was like inside sales / ABM marketing, somewhere in there, with zero tools, zero knowledge, and really just kind of winging it. And it was wildly successful, like did really well, loved every minute of it. And the commission helped a little with that. And I was sort of off from there. I kind of caught the bug. Then I went to doing some freelance, words were always something that I've enjoyed and come pretty easily. So I started freelance content marketing for still in B2B health tech. Did that for a while, went in-house heading up content marketing for a practice management software solution out of Australia called Clinico. Yeah, so I head up their content marketing there for a while, went back to doing some freelance work, and I just saw a big uptick in people like needing the kind of stuff that I was doing that I hadn't really seen before. So made the choice to formalize the agency, built up a team. We were doing good work, but it was rough going for me. I just hadn't built up the processes correctly to really support what we were doing. So made the tough call to scale down, at the same time that I was also sort of formalizing, crystallizing my thoughts around some patterns that I was seeing in the clients that we served. So, invariably people would come in and say, hey, we need a blog post or a white paper or some sort of marketing content. And so we dive in and start figuring things out. But there was almost always some sort of foundational work that needed to be done. There was, audience interviews or talking to internal team members, leaders, competitive analysis, these types of things that just weren't really dialed in yet that could really support what we were doing on that piece of content. So we'd go upstream and we'd do that work and then use it to inform, the original task. And so when I scaled down my team and went back to just me essentially as a consultant at that point, really focus on that upstream stuff where like I feel like that's where the most value is, what I can bring to really help people the most. And that's where we live now. So starting to scale back up, not in any rush. We're getting there slowly and at a healthy pace, but it's very much focused. I kind of put it into 3 buckets in terms of the value we bring. So there's the audience work, really dialing in all the stakeholders, decision makers, influencers, whoever needs to be made happy during the sales process. And that can start from the brand awareness stage, very much in the marketing world, all the way through to final execution, closing deals, very much in the sales world. So the whole spectrum there. And I sort of see me and the services we provide as the bridge between marketing and sales. So we understand the audience, we formalize our understanding into a messaging that everyone, sales and marketing, leadership, everyone can agree on and use consistently to build the trust that's required to get deals over the line, and then lay out a content strategy and execution on sales enablement tools that are really going to get the job done. Again, from the brand awareness stage, like marketing level content, all the way down through pitch decks and one sheets and different kinds of things that are really going to facilitate the sales process, hopefully make it a little bit faster and smoother and more efficient than we typically see in healthcare.
Yeah, spot on. I didn't know that about you, about being a professional country songwriter.
We didn't talk about that?
No, we didn't. And I think I'm sure that experience copywriting, while it's not in the med device or health tech space, translated well.
Big time.
Your like insights on like I see that in my line of work, a bunch as well around, when teams go to, like our clients have done it too, like when they go to create a white paper, or let's just say a case study with a client, or
Mm,
it's like, so, yeah, like you said, there's a lot of like upstream stuff that that needs to be done, and it often acts as a blocker to them spinning up new content, whether it's like interviewing, their current clients, whether it's doing that competitive analysis to see like what are their competitors doing in the market.
mm. Yeah.
Sometimes, like, we all know content is king. Content is how you build trust with your online audience. It's like that's what they want to see before they get on a call with you.
Mhm.
Content is how you are able to demonstrate your social proof sometimes, and your credibility of how, hey, we've delivered this result, or this is our point of view on this topic. It becomes your social proof and credibility as a company, and it's instrumental in, like you said, bringing that bridge for marketing and sales, but more importantly, like building your audience online. Like companies that have good content succeed.
Yeah,
Yeah.
absolutely. And before we dive into which why I feel like we should clarify the definition of content, because more and more I'm hearing content being referred to as what we post on LinkedIn. And it's that can be a small percentage of the content, but it's much,
Yeah.
much more than that. From the website to sales tools to what you're setting up and handing out at live events, it's it's
Yeah.
all things, not just LinkedIn. So
Absolutely.
just want to clarify, because I'll get people that, they're like, oh, I love your content. Like, what are you talking about? You're like, on
Yeah.
LinkedIn. Like, oh, okay.
Yeah.
Yes.
Yeah. That's almost like a given, right? Like I feel like as like a leader of a health tech company, or that's something that's like your foundational level, is like content that you're posting on social media. The real secret sauce comes in like content you're able to disseminate to your target audience and your prospects. Like, what is it that
Mm,
the eyeballs online are going to look at and view to be educated on your service, product, solution, etc.
hmm.
And that can
The
come like
right eyeballs.
the right eyeballs. Yeah.
Yeah. Yeah. Like your ideal customers, what do they care about? Where are they at? If we did a project once where the physicians, or excuse me, the executives that were ultimately making the decision on the buying purchase, they were pretty active on LinkedIn. So we knew to target them there. But the radiologists, who were ultimately the end users and the influencers and the champions who we needed to get on board before the executives found anything out, they're not on LinkedIn. They're on what was Twitter at the time. So
Mm,
like, you had to know that so that you could address your audience in the right ways, in the right places. And that's where that audience research really comes in handy, where you know your people so well that you can't help but deliver for them.
yeah. That's spot on. I love that example, because like, yeah, healthcare is like 1/5 of our economy in the US, and like
Mm.
not all those eyeballs, like you're saying, are going to be on LinkedIn, or not all of them are
Hmm.
going to be on X or Twitter, like, so yeah. I want to ask you, what are your thoughts on like the current experience for like health tech companies when it comes down to content, like the content you're building for them? Like what's fundamentally broken in how they approach content building today? You started to touch on it, but I'd like to like double down on that and
Yeah.
talk about it.
I have some things. I have some soapboxes. I'll try not to stand on all of them. I think the biggest issue really does boil down to what we were just saying about understanding and genuinely caring about the audience. Like, it's great to develop a product that can solve a big important problem, but if you don't understand your audience enough to make it usable and fit within their workflows and things, they're never going to use it, right? So that's a big part of product development, hopefully. But it goes beyond that then for the marketing and the sales. Like, how do you talk to these people? How do you get them interested in it? How do you let them know that
Right.
you care about their situation, that you understand their situation, that you see them when it seems like no one else in healthcare does,
Right.
right? Those kinds of things. So like, I think a lack of understanding in that regard leads to so many downstream issues, primarily just in how we're communicating and what we're communicating. So, it's almost cliche now to say that, actually probably is cliche to say that, don't use jargon in your marketing, don't just give features list and things like that. At least in my world, it feels pretty commonplace, but perhaps I'm just biased because I live in the marketing and sales world. I think that is really what I see. I can't tell you how many websites I've seen that said, we're transforming healthcare, we're revolutionizing the way that healthcare is done. Like, no, you're not. No, you're not. And the fact that you're claiming that
Yeah.
tells me that you don't understand who your audience is, because your audience is not all of healthcare. They don't want you to transform all of healthcare. They have a unique, acute problem that you can solve. So
Right.
address that, right? So like, That I think is ultimately what we're going on. Those are the symptoms, but it boils down to like knowing the details. I talk about getting into like the kind of the neuroeconomic, the emotional level of your audience and what truly moves and motivates them, and understanding that just crystal clear.
Yeah, that's spot on. And like I couldn't relate to you more on like not using jargon and feature lists. Like it's amazing the amount of like existing copy I'll look at for clients or things they suggest and they still want to bullet out like feature list, or put that
Hmm.
over their content on their website. And it's like both you and I know that is not what the healthcare audience is looking for. Like you said, they want something that's usable, useful for them. They want to understand what niche or problem specifically are you solving? What is your claim for that? Like how are you going to help me with that? And like,
Yeah.
I think a lot of, what it is too, like a lot of health tech companies know it. Like it's not that the founders and the CEOs aren't intelligent people and they know what that is. It's just a communication thing, like not putting it on their website, on their cloud or on their content. Like it's in their head. If you speak to them and get on a conversation with them, they'll have a very educated convo on you on like the exact metrics that they're solving. But it's like, it doesn't come across in their content. Like, would you agree? Like that's the
Oh
case.
yeah.
Yeah.
Oh yeah, no, it definitely doesn't. Eight
Yeah.
times out of 10, we'll say some people do it really well, or some companies. So we don't want to paint too broad a stroke here,
Yeah.
but no, it's a widespread issue, and I think a good way to think of it is, so many of these things are niche, and yeah, I think we're seeing a bit of a transformation going back toward more comprehensive platforms and things like that. But even for the point solutions or wherever it falls on that spectrum, people aren't searching Google for whatever the name of the solution is, right? They're not looking for better workflows. They're not Googling that. They're
Yeah.
just pulling their hair out, hoping they can get better sleep at night. So like they're not Googling for that. But
Yeah.
that's what you need to address is like the actual pain that they feel in their day-to-day work. How can you help them do that?
Yeah.
And communicate your ability to help them do that. And of
Yeah.
course,
Yeah. You're telling me.
communication.
I feel like that's part of my like job week to week is just trying to extract that from clients because they know what the pain is. If you start to ask them questions, they'll get there eventually. They know what it is. It's just again putting that down in written and verbal like content. What I'm trying to say is not just written, but like there's like visual based content as well, right?
Oh yeah, whatever they prefer is what I recommend for clients. Like it's never even my preference for whatever I think might work best or like what I like the best. It's literally what the audience
Yeah.
wants.
Yeah.
That's always the right path.
Yeah, and on the point of pain, I'm gonna make it really real. Like I think speaking to a lot of and interfacing with a lot of leaders in this space of health tech, there's a big reliance on like going to conferences, and
Mm.
events in person. Like absolutely. I think the healthcare industry, even life sciences, is one that's very relationship driven. Like you need those in person touch points. What like type of content have you found to be like most effective for like either pre or post like conference slash event like outreach that you've run into with your own clients?
I like the idea of in-person events. I think they present a good opportunity for us to bring some humanity into the brands.
Yeah.
So no one buys from a company. We know this. They buy from real people. And when you can get face to face with them with actual real people, it makes it a lot easier to sort of inject that humanity. But I think that idea of bringing that humanity into the brand should be kind of the North Star for any content that might get developed for the pre or post efforts where or even during, where it's the outreach before the show should be very human. It has to be manual so that it can feel more human. Be manual about it. If you want to go analog and actually call people on the phone, great. Do it if
Yeah.
it works. But
Yeah.
like, how can you be human in your efforts instead of having that bot send out the same message to every attendee on the list,
Yeah.
that you
Swing
paid
by
for the
our booth
sponsorship for?
and we're gonna be like
Yeah.
displaying this and these features and like no one cares. It's like
No, no, they're not going to come to booth number
yeah,
1435. Like,
yeah,
no, what they're going to do? They're going to walk right past and hope that you don't make eye contact. Yeah.
yeah. No, yeah. I'm like smiling because I've literally had examples of that where the most effective like pre-conference outreach we do for clients is when it's very human like. It's like, hey, I see you're speaking on this topic, like, and we insert the topic. This is something I'm interested in. Like, are you open to meeting and talking shop at the conference? Like that
Hmm.
crushes. Or like, hey, like I see you work in this space. Like if it's a specific vertical, like we're going to be actually showcasing something brand new at the conference. Would you like to take a look? Or hey, we're going to be hosting like a exclusive dinner or roundtable with folks. We think you might be a good fit because of blah blah blah. Like it makes it very human. It's like, and like you said, it's all about making that feel human. Like I couldn't agree more.
And yeah, and whatever we do, before a show or at a show, the digital content that exists to support those efforts again should be really dialed in for that audience, so that if you
Yeah.
have whatever, we'll just say like print little postcards that you hand out 5,000 of those things, maybe a couple hundred will actually look at them long enough to realize that there's a QR code, right? But for the ones who look at it, like they might be looking at it because you understand your audience, the words that are on there caught their attention because they are your ICP, and you want them to use that QR code to get further bought in on your brand, right? So that
Right.
digital content that they scan better be really on point. And when it
Yeah.
is, and it's catered to the event and it speaks to them in the right ways, you're much more likely to see a return on that event investment, even without booking a sales call or having a direct conversation with someone.
Yeah, absolutely. And the QR code point is so real because like 80-90% of the conferences out there that I think health tech leaders, executives go to, they literally, everyone has like a badge that, you get to scan a QR code with. And like, what do companies do with that data? Like probably not, enough, right? Around like actual intentional outreach besides, hey, I saw you swung by the booth or we spoke, like, do you want to get on a demo? It's like, okay, that's not what's going to end up selling the person, like referencing specific things you talk to them about, things they
Yeah.
brought up, like reasons they were there, and relating that to your offer, product, service, solution, etc. Like that's what's going to drive the conversation forward.
Yeah, 100%. Again, it's like you said, like bringing in stuff from the conversation, being relatable. It goes back to that human component. Like,
Yeah.
be a real person, represent your brand well by being real. Don't just try to push somebody into a sale. Like, hear what they have to say. If they don't actually need it, it's okay to say that.
Right.
Like you're laying the groundwork, because for all you know, they're going to be at another company in 8 months that really does need what you offer.
Right. 100%.
Like it's better to create a good impression when you have that opportunity than to ruin any chance of future work.
Yeah, spot on. And I'd like, if we can, to get off our soapbox for a second and talk about some
Oh,
of like the approach that you take at HealthTech Content to help like health tech companies. Because I know you and I chatted, and you do a variety of things from copywriting to content evaluation for websites, for handouts, for white papers. Like, and you started to touch on this earlier, but can you fill us in on your approach to helping health tech clients with their content and some of the real like world impact you're seeing so far?
yeah. As I said, I won't get back on the audience soapbox, but like once we know the audience really well, either from research that we're doing, interviews we're doing, et cetera, or something that the client's able to bring to the table to sort of remove the need for that effort, we take that, we understand it, and then we spend a lot of time like really dialing in the words, like how to communicate the right ideas, and specifying that for each stakeholder. And so, for example, regardless of the solution, right, you run into some patterns, right? CFOs, they always care about risk. It's all you really need to address. Like, help them feel like this is a low risk or no risk solution.
Yeah.
CTOs, they don't want to overwhelm their team with new implementation, but they also want to make sure that they're showing their team is like being fully capable and doing big work and things like that. So there's ego involved too, and protectionism that needs to be addressed. That's a very nuanced, tricky thing to do. So like, how can you craft the right message for your solution and your implementation path for that CTO? So, things like that, really dialing that in all the way down to the end users and the champions who ultimately are the ones that are being served, well, unless it's patients, of course, but I think I'm glad that came up, because I think so many, I won't say all, but so many solutions that are designed, even that patients never see or hear about.
Yeah.
The hope is that by freeing up some time and some brain space, lowering stress for the clinical team or the administrative team in some way, that's going to benefit patients ultimately, right?
Right.
We see that a lot in people's marketing, with freeing up your time so you can focus more on patient care, right?
Yeah.
I say like 20 times a day. That's another jargon thing. Don't use that.
Yeah.
But the idea is there, right? So even addressing that in the messaging, because the doctors, nurses, clinicians, the executives, they, believe it or not, Like despite all the the problems in healthcare, they really, really do care about the patients. They
Yeah.
really want to help them.
Yes.
And and by ignoring that and not infusing that patient care and concern into your messaging, you're missing a real opportunity to connect on an emotional human level. So
Yep.
like really wrapping ourselves around all of that stuff and formalizing it in a way that everyone on the team has buy-in on, right? So there's no like power struggle between sales and marketing. Everyone agrees, everyone uses it.
Yeah.
There's support from each other, when they're reviewing their own sales calls, like, hey, here's an opportunity to do this part better, or like try rephrasing it in this other way, that kind of thing. But having that foundation and the tools necessary to really build that up within the team. And then, yeah, and then that content strategy, like, where are the gaps? What questions are you seeing? What objections? How can we preempt those? How can we help people feel that their needs are being addressed, even if they're not a decision maker? You know, for example, we'll just go back to the CTO, right? Maybe they don't actually have decision making authority on a particular purchase, but they can definitely kill a deal, almost across the board, right? So if you're not addressing them, then you don't stand a chance. So like that kind of a stuff. How can we make sure that no stone is left unturned? And then iterating over time. As feedback comes in from the field and those calls are happening, we're going to learn more and more what works, what doesn't, and how to make improvements over time. And I mean, in terms of what I'm seeing from all of that, it's pretty incredible, actually.
Yeah.
It's confidence, it's peace of mind, it's a certainty that the path forward is the right path. That you're not just throwing money out the window or spaghetti against the wall, seeing what sticks. Like the right path because it's all based on the audience. You've taken the time, you've tested the messaging with the audience to make sure it's actually going to work. And then you're putting it out there in ways that are meaningful and really maximizing what you already have too. So what I'm seeing is faster results than what they were getting before, better results, shorter sales cycles, within reason. It is still healthcare. Nothing's happening
Yeah.
in 2 weeks.
Right.
Uh,
Right.
but yeah, like everything's moving in a positive direction because that heavy lifting was done up front. And
Yeah.
then you have that foundation for all future efforts.
Yep. Yep. No, I couldn't agree more with, especially what you said earlier about dialing in the words of how you communicate to each stakeholder level. It's amazing
Mm-hmm.
the amount of companies we come in or they want to launch a new campaign into a new market or, expand into an existing market they're in. And
Mm-hmm.
the targeting strategy is always like, well, we'll just go after the entire C suite, CEO, yeah, that's our targeting strategy. It's like, okay, but what does each person in the C suite care about? Like, what are they going to lean into? Like,
Mm-hmm.
I have found countless examples of when we'll get like an interested like lead for a client, like we work through a campaign, right? Because half the battle is like getting the interest and the other half the battle is like getting them on a call and then converting that into a deal and then, a deal opportunity and then finally, a new client, right? It's a whole,
Mm-hmm.
but like what I found to be extremely effective is relating when you make the communication back to the person and you relate it to what they're currently doing in healthcare. Like for example, if you're reaching, let's say a nurse at a big like magnet designated hospital and online and you see this nurse like has oversees their virtual workforce initiative or they're over a specific council, right? Like and you relate to that in your response back to them, like the odds of them being willing and open to hear you and speak to you like skyrocket. And it's amazing the amount of like teams out there that don't take that extra step and then apply a blanket like, hey, thanks for your interest, like let's get on a demo. So what I'm
Mm-hmm.
trying to say is like I 100% agree with you on communication to each stakeholder, and it matters on the initial outreach you send them and also when you hear back to them. It needs to continue. It's like,
Mm-hmm.
and that's what gets the really warm positive interest to people that are willing to like be your inside champion or move a deal forward.
Yeah. Yeah, 100%. It's again, it comes back to being human. And I think a big part of that, just to drill down into a little bit more, because being human is rather vague. But to your point, just listening, like being a really good listener and
Yeah.
and not just waiting for your chance to talk or like how can I take this and use it into what I'm going to say next, but listening and there are countless books on this, right? But like how to listen appropriately and how to respond appropriately, so like you acknowledge that they feel a certain way, but like, so I'm hearing this, and like those types of things, it sounds rudimentary. It sounds, archaic almost to do that. And it should never be that robotic, but the ideas are there to like be such a good listener that you retain the information better longer than you would otherwise, that they feel a stronger connection to you than they would otherwise. And
Yeah.
in the process, you're facilitating the sales process further, faster than you would have otherwise.
Yeah. And I think that's like what it ultimately why companies, I think, in this space rely so much on warm connections, because they don't want to put the time or energy to like make those personalizations at both like their copy level of like the content that they're publishing and the types of like leads or prospects that they interact with. It's like, and when you're going out into the mass market, it's almost like you need to do that more than an existing warm connection. Like that feels warm and
Yeah.
fuzzy. It's nice. It's like, okay, I'm working in the industry. I have a buddy who's a doctor who knows another doctor who might use this. Great. Let's, introduce me. Or I know someone that heads up an association of providers that I can connect someone to, right? Like that feels warm and fuzzy. That's nice. But the hard part is understanding the market at large and being able to speak to them. And then when you get their interest, reeling them in. It's like, I give the analogy of fishing. It's like we're out fishing, and with clients, you and I are navigating the boat to where the reefs are with fish. And we know the sink, the lure, the type of rod, the line that we need based on each reef, because each reef represents like a different market, and then when you get the fish on the line and reel them in onto the boat, that is the message you're writing back to them. That's got to be personalized and catered to them. Otherwise, if you pull that line too fast or you don't reel them in quickly enough, you'll lose them or you'll lose that fish.
Yeah, cool. And it's tough though, right? Like I sort of feel for companies because a lot of it's a numbers game, right? They have to have high volume to actually, hit their quotas and make things happen. So like on one hand, you have to be as personable and personalized as possible, but at the other hand, you have to do it really fast. Right?
Yeah.
And those two don't always work together. It's pretty tough.
Yeah. What do you think, like, if both you and I know that it makes a lot of sense to do the things we're talking about, what's standing in the way for companies? Is it the quota that you just mentioned? Is it like a thing I see too is funding? I think a lot of marketing and sales initiatives that I think teams will put off in the health tech space because they're waiting for the next round of funding, or they're fundraising. And it's like, well, I'll wait till I have money to like, do this. Right. What do you see from your end though, as like some of these barriers to adoption?
Yeah, I see the things that you mentioned, but I sort of view those as symptoms. How I think of the root problem is really just fear. It's fear of risk, of making a bad choice, of, you know, not getting the return, of shortening the runway without, the results that they were hoping for, or whatever their situation is. It's comfort with the status quo.
Yeah.
And for some companies, that status quo is spending 10, 30, $50,000 a month on Google ads or LinkedIn or whatever it is, right? And
Yeah.
and they feel more comfortable with that because it's black and white. We're like,
Yeah.
spent this much, brought in this much, quantified, crystal clear, right?
Yeah.
But this other stuff that we're talking about is very qualitative. It's not black and white. It's gray. It's squishy. It's hard to define and wrap our brains around. And so that in itself, I mean, that's inherent risk, uncertainty, right? Because that lack of clarity makes them feel nervous. So I think that's a lot of what those
Yeah.
symptomatic, objections really stem from. And, so that it sort of puts the onus on us to, I don't want to say educate, but, just support people in understanding the value of qualitative understanding and qualitative approach to our marketing and sales, just because it actually does make things faster and cheaper. Those Google ads will perform better than they would have otherwise,
Yes,
but yeah,
exactly.
it's not always easy to get that message across.
I always tell clients that it's like, please don't run Google ads or spend more money on it until you know like the message and your audience, like the message that converts for your audience. Like
Hmm.
just ramming money behind ads without knowing that is a recipe for failure. Like that's what it is. Calling it how it is. Yeah,
Oh yeah. Yeah.
yeah,
But we've trained an entire generation of business people to think that quantitative data is the only right way to look at things. and it's simply not true. Like there's so much qualitative stuff. Look at Google's marketing. Look at Apple's marketing. It's all emotion,
It's all
right?
emotion.
Like,
Steve Jobs said
yeah,
it, right? He's the GOAT marketer in my opinion. It's like people buy because of the way they feel about your product. Like you
right.
walk
But
into an Apple.
these are the companies that are helping us feel like quantitative, that the black and white world is what matters most. Meanwhile, they're serving us the qualitative.
Yep.
And that's, I think, an important thing to really let soak in, that this qualitative stuff is actually what makes things happen. And the
Yep.
quantitative is still very important. It helps us determine, validate ideas, or to get a clear path on what comes next, those kinds of things. But without the qualitative understanding and approach, they're bound to be less effective than they could be.
I love that. Like they're feeding us the qualitative to get to the quantitative outcome, whereas a lot of
Yeah.
companies think the other way. It's like, let's feed the quantitative input. Let's just put money into ads or, run some campaigns and get a qualitative outcome. It's like, no, no, no. It's like,
Hmm.
it's almost like the opposite. Very, very interesting perspective. I like that one. Yeah, to round things out here for us, for folks like listening and hearing this conversation and thinking, this is the type of partner we need. I like Doug's, and even Bert's like perspective on marketing and sales and content development for health tech. How can they engage with like you and your team online?
I'm fairly active on LinkedIn, not as much as I used to be, but I'm going to get back on the horse. So yeah, LinkedIn's a great place to find me. Doug Pohl, P-O, and of course Doug at healthtechcontent.com.
Very cool. And for any eager listeners, any sort of plans for the next like 6 to 12 months with your own like marketing and content that the listeners might want to hear about?
Hmm. I should have prepared a way around this question, because I do have some things, but I'm not ready to talk about them yet.
Yeah, yeah, all good, all good.
But
Yeah,
yeah, big things are coming this year.
I could help you out. One, like I know one that we're seeing on our side is AI, right? Like every company
Oh
wants to
yeah.
adopt AI, and like
Yeah.
you can use AI for, and it might not come to a surprise. Like you can use AI for marketing and sales these days, right? But it's like,
Hmm.
how do you create? Like one thing we're working on is like creating like an AI SDR for clients that is trained on their like all these things we were talking about on like their target audience, the different stakeholders, the type of message that matters, like training an AI that picks up by client that data, and then as you get leads and prospects through the door, it can like not replace the human's job, but at least like suggest a reply, take that initial like brainstorming period out of the way so that your junior staff team, right, that is not as doesn't have the sales and marketing like acumen you have, can at least create an informed perspective on something, that's not just based on their like years of knowledge or lack of, so that's something that I'm excited that we're building, and I'm sure you're starting to look at ways to
Oh
build
yeah.
AI into your content workflows, right?
Yeah, 100%. Tons and tons of potential there. And yet, like, not worried about, losing the value that we can deliver for clients, or the need that they might have for us. Because, especially with messaging, like you mentioned the SDR bot, where like a low level, kind of, entry level hire could sort of facilitate that bot, but only if they have that messaging as a foundation and tools that they can refer to where they really understand the audience as well as the founder does,
Yes,
and being
exactly.
able to guide the AI bot, because even the best, AI tools that currently exist, they're still like little puppies that just want to make us happy, right? So they'll spit
Right,
out
right.
a lot of things that aren't always right, even just knowing, because it's going to make us feel like it's right, like, oh, that was good. But then you
Yeah,
drill into it and be like, you just made that up. That's not even a real thing,
yeah,
right? So
yeah,
you
yeah,
you have to have those foundational tools for those entry level hires to be effective and correct those types of things as the AI puts them forth.
100%. I think that's well said, is like guiding it as well as the founder does or the leadership team. Because like they're busy. They don't have time to get involved in every single lead, every opportunity realistically, So we need to find ways to still get their voice and their message across to the rest of their team, and AI
Hmm.
can play a role in that. And I think we'll see more of it as the years go on here, So
Yeah. Oh, for sure.
yeah.
Yeah.
But yeah, Doug, it was a pleasure having you on the podcast today. I think we'll definitely be staying in touch and excited to see each other's, book of business grow in the whole tech space. And then, this is an area that there's a lot of innovation happening. A lot of companies, feels like every month I see a new company pop up or a newly funded or VC PE backed company come around. So there's no shortage of need and opportunity in this space. And yeah, looking forward to staying in touch here.
No, man, thank you so much for having me, Bert. Really appreciate the invitation and the chat. It was fun. Thank you.
Yeah, likewise. And enjoy your Memorial Day weekend.
Oh, yeah, you can count on it.
All right, take care.
Yeah, thanks.